What exactly is obesity? So, a lot of us are used to using this word, but we may not necessarily understand what it truly means in the medical sense. And that's what we're talking about here, right? So, this word, obesity, is often used to describe someone's size or their weight, or just describing the person itself. But it's important for us to remember that the word obesity is actually describing a disease state. So, obesity is a chronic, relapsing, progressive disease. So, it is not as simple as the size of someone's body or the size of their clothes or the weight on the scale. And it doesn't necessarily describe someone's fitness level or strength or ability level. So what we do use the word for is to describe a diagnosis. So when someone has obesity, it simply means that they have more adipose tissue, which is our fancy word for fat tissue, than is healthy for their body. So two things usually happen. So when the amount of fat tissue in our body gets to a higher level, it puts stress on joints, puts pressure on other organs, and can create disease states and reduce quality of life. So we consider that to be a disease state in and of itself. And then when our fat tissue levels get to a point where it it expands beyond the space below our skin and expands into our liver, our pancreas, our other organs, and then creates like outgrows its blood supply and creates a lot of inflammation. It starts to make us sick in other ways, like metabolic syndrome and diabetes and cardiovascular disease. So, in these scenarios, we definitely consider obesity to be a disease. But notice that none of that is definitely linked to what the number is on the scale or the size of your body. So, in order to diagnose obesity, we have to be able to assess what somebody's body is made of. So, our bodies, for the most part, are made of organs, bone, muscle, and those are types of organs as well too, and water. And one of the organs in our body is adipose tissue or body fat. So there are general ideas as far as what is a healthy amount of subcutaneous, so the body fat that's right below our skin, fat tissue, and visceral fat tissue, which is the amount of fat that may have spread into our organs. So when we are able to use certain scales or scans to evaluate what the body is made of, we're able to tell what someone's body fat percentage is. And this is one way that we can tell if someone has obesity. The other way that we're able to tell is we will do a full evaluation of someone to see how their weight may be impacting their health. So the weight in terms of like how their overall like body weight and adipose tissue weight from that body weight is impacting their health. So if we don't have a body composition scale or we don't have a scan that we can use to tell us, we will accept the standard weight from a scale, usually try to take other measurements like around someone's abdomen, meaning their midsection, and then we'll look at other parameters of like what other conditions do they have that may be related to their weight, whether they have metabolic syndrome or high cholesterol or high blood pressure or inflammatory conditions, or do they have a lot of chronic pain? Do they have diabetes? Do they have heart disease? What of their risks and exposures or their history of cancer been? Because we know that so many of these conditions are related to obesity. And then we take all of that information together, and only then can we really give someone an appropriate diagnosis. So when we have diagnosed obesity, what is our treatment goal? Again, so many people come in and they get the diagnosis of obesity, and we focus on a weight number as our treatment goal. It's only one measure and not part of everything. I know a lot of times in healthcare, we have different standards where people have to meet weight measures for it to be determined to be effective, even with some of our medications we may use to treat this chronic disease. But it's only one measure. So often when we're treating the disease of obesity, we have to remember that there are so many other measures that we're using to assess how well we're treating this condition. So weight may be one of them, but our body fat percentage going down is another one. The improvement in all of our conditions that we may have related to obesity is another one. So maybe someone doesn't hit whatever magic number on the scale is that they're looking for, or that the BMI chart maybe says that they should be, but they're off their blood pressure medicines, and they're off their diabetes medicines, and their cholesterol is very well controlled, and their level of endurance is higher with activity, and they're not tired throughout the day anymore, and they can crawl around on the floor with their kids and easily get up. So these are other measures of success that we use to evaluate how well someone's obesity is being treated and whether or not we're having treatment success. So I hope this helps you understand a little bit more about what obesity is and what it isn't, and the broad range of measures that we use to evaluate treatment success beyond just the number on the scale. So keep watching, subscribe, as we'll continue to go through all kinds of different concepts. And if you're in Wisconsin and you need help with treatment of obesity or trying to find what your best weight is, please come and see us at Weight and Gold.